Hey everyone, I'm Dr. Tyler Tolbert from Smile Now Dental Group. This might sound surprising coming from a dental implant provider, but it needs to be said. Sometimes we say no to patients, and we do it for a reason. This video isn't about judgment, it's about responsibility. Because the truth is, not everyone is ready for dental implants. So today, I'm going to explain why we turn some patients away, what not ready really means, and how saying no now can actually protect your long-term health, finances, and outcome. Dental implants are not a quick fix, they're a commitment. So let's start here. Dental implants are surgical, permanent, and life-changing. They're also not reversible once placed. So when we accept the patient, we're not just offering a service, we're accepting responsibility for a result that needs to last 15 to 25 years or even more. If someone isn't in a position medically, emotionally, or logistically to go through that process safely and successfully, we're going to hit pause. That's not us being difficult, that's us doing the right thing. You must remember that while you are in the driver's seat for your own health, undergoing treatment like this is a partnership between you and the office that's treating you. And it's important to understand that it's a two-way commitment. If an office seems terribly eager to treat you despite your own trepidation, that might be something to be wary of. We work to ensure that you are making a well-informed decision and are adequately equipped to undergo this process. Here are some of the most common reasons we'll turn a patient away or delay treatment until the timing is right. Number one is uncontrolled medical conditions. If someone has uncontrolled diabetes, single or multiple organ failure, a history of cancer, or serious heart issues that haven't been cleared by a doctor, oftentimes we will wait. Implants placed in an unstable medical environment are more likely to fail, and we're not willing to roll those dice with your health. While it is common in our line of work to operate on patients with complex medical histories, we know where to hit the brakes in the interest of our patients. Number two, unrealistic expectations. Sometimes people come in expecting a Hollywood smile overnight or think that they can get permanent zirconia teeth in 48 hours after the surgery. We've explained in some other videos why that's not always the best idea, and when we explain the biological timeline and they're not open to that, we'll recommend that they reconsider. We're not in the business of rushing or over-promising on results. We know that we can deliver, and we're very clear about what we're delivering on. Number three, financial pressure without clarity. We work hard to make implants affordable, but if someone feels pressure to move forward with financing they don't understand or can't sustain, we pump the brakes a little bit. The last thing that we want is for someone to feel financially trapped during or after treatment. That said, we do assist in helping you find third-party financing options that allow you to apply and see your options without even affecting your credit. Number four, poor oral hygiene or lack of commitment. Implants require care. If a patient hasn't shown a willingness to maintain their oral health, especially with previous dental work, that's a red flag. We're always happy to educate and support, but the patient has to show up ready to participate in their own success. For many patients, we need to transform the relationship with visiting the dentist and create a positive relationship. This is crucial to the long-term success of the treatment. So if you're looking to get this done so you never ever have to see a dentist again, let's think again and let's try to reframe that conversation. Number five, emotional readiness. This one often gets overlooked. Getting implants, especially full arch, is a big emotional shift. You're changing how you look, how you eat, and how you speak. If someone's not emotionally ready for that transformation, we pause and encourage them to take time to prepare for that. The good news though is that with our workflow, we're often able to recreate nature the way that it feels to you to be natural. And so while a lot of these changes can sometimes be dramatic, they're almost invariably dramatic in the best way imaginable. So take a look at our before and afters and see for yourself. We don't say no to punish, we say it to protect. Let me be clear, saying no isn't about being exclusive. It's about being ethical. We've had patients who weren't ready 6 months ago come back and absolutely thrive. We've had others thank us for not pushing them into something that they weren't totally ready to commit to. Because the worst case scenario is doing full arch implants for someone who isn't ready, medically, financially, emotionally, and then watching the case fall apart because the commitment didn't go both ways. That's traumatic for the patient and it's frustrating for the provider. It's a completely avoidable situation, and that's why we lead with honesty and transparency about your situation and your preparedness to go through with treatment. When we tell someone they're not ready, we don't leave them hanging. At Smile Now, we offer next steps to improve medical readiness, referrals to physicians or specialists, honest financial guidance and alternative options, emotional support and education on what to expect, a timeline for reevaluation when the time is right. This isn't a no forever, it's a not yet, and here's how we're going to get you there. We're in this for the long game. We believe in doing the right thing, not the quick thing. That's why patients who are ready get results that last. And those who aren't, we meet them with compassion, clarity, and a plan, not pressure. Your smile is too important to gamble with, and you deserve a provider who sees the whole picture, not just a payment. So if you're thinking about dental implants, but you're not sure if you're ready, let's talk. Click the link in the description below to schedule your free consultation at Smile Now Dental Group. We'll take a look, ask the right questions, and give you a real answer, even if that's not the answer you were expecting. So thanks for watching. Be sure to like and subscribe for more honest conversations about dental implants, timelines, and getting it right the first time. See you in the next video.